So in this case, we decided to do a no-shave hair transplant. So we'll be shaving a very small strip of hair at the donor area to extract the grafts. So prior to starting the procedure, the vitals of the patient are taken. The blood reports are checked for basic parameters. The numbing cream is applied on the areas where local anesthetic is to be injected. The first step of this procedure is to take the test grafts from the donor area. Firstly, a nerve block is given at the base of the scalp so that the whole area at the back of the head is numb and it is comfortable for the patient when the local anesthesia is injected in this area. After applying the nerve block, small area is anesthetized, giving local anesthetic, that is lidocaine injections. Then we take out around 10 grafts from the donor area. These grafts are checked for their length, their quality and their thickness. So once we have measured the length of various grafts and come to one conclusion, one average length, we decide the size of the blade that is to be used to create the slits. Following this, the patient is turned around and we mark the hairline, and this finer details of hairline are marked. Then a nerve block is given just above the eyebrows so that the whole, after applying the field block around the hairline, we create slit pockets for the grafts to be placed. These slit pockets determine the shape of your hairline, the height of your hairline, the angulation of your grafts to be placed, and the direction in which your hair will grow. So this has to be done very meticulously. If you end up giving the slits which are longer than the grafts, you'll end up having a puckered sort of appearance at your hairline. If the grafts are longer and the slits are shorter, you'll end up having a bump sort of cobblestone appearance on the hairline. So this is a very crucial step in any hair transplant, that is the slit size and the slit direction and the placement and density of these slits, because these determine the ultimate outcome of your hair transplant. Once these slits are placed, we turn the patient around and the extraction of grafts is done. Now this extraction is a very crucial step because over extraction from a small area can end up giving a very paddy field sort of appearance in the patients, where some areas are completely devoid of hair and the other have thick hair. And sometimes people end up with linear scarring if grafts are taken too closely, and sometimes the grafts are waste because there's a high transaction rate. So at Glo Medispa, we make sure that the transaction rate is less than 4%. That is, if we take out 100 grafts, more than 96 grafts of yours are viable and placed in the recipient area. After the grafts are taken out, they're placed in a ringer lactate solution. They're sorted out according to their thickness, and then the grafts are placed back into the slits using the implantation forceps. Now the trick here is to not touch the root of the graft so that the graft is viable and not damaged. Yes, the placement of grafts during implantation is very important. If the thicker grafts are placed in the anterior hairline, you'll end up having a very unnatural hairline at the front. So these grafts are dissected into the follicles as 3-unit grafts, 2-unit grafts or single hair grafts, and placed as such so as to give a very natural front line in your hairline and to not give you very bushy temples. Once the implantation is done, the patient is cleaned and bandaged, and then some antibiotics and painkillers are prescribed. There are certain post-care instructions that are given to the patients, and they can immediately go home after the procedure and continue with their daily activities 72 hours after the procedure is done.
Hello, my name is Vivek. Today I am visiting Glo Medispa, Ludhiana. My friend suggested me this place. Actually, I have a concern with hair loss near my temple area and forehead area. So I concerned with my doctor, and doctor advised me to do a hair transplant. So today it's my session for the hair transplant. Let's see the result after that.